What I wanted to do is to focus on some of the research that has shown that environmental toxicants in particular serve as risk factors for the development of ADHD. And the reason I think this is particularly important is not because it will help us think about treating children who already have the condition, but rather because we might be able to prevent some children from developing ADHD by focusing on some of the toxicants I'll talk about today. And this shouldn't necessarily surprise us. The kinds of toxicants I'll talk about have been shown both in animal studies and in human studies to impact the nervous system, the brain tissue in particular. And so this shouldn't be a particular surprise. And I'll try to walk through why we think that lead in particular is an important problem that we can begin to address in the near future and has particular relevance to Saudi Arabia, in particular with the exposures to leaded gasoline, even though that has been banned. But of course, children who were born at a time when they were exposed are experiencing ADHD. So just a very general context or background to the focus on environmental toxicants. First, most of the toxicants that we recognize, mercury, PCBs, lead, and so forth, were only discovered as a result of environmental disasters. We really don't have any systematic approach to identify these before they're distributed in the environment through consumer products or what have you. Second, there's increasing evidence linking toxicants with cognitive deficits like intellectual abilities and behavior problems at levels previously thought to be innocuous or safe, despite the fact that we've seen dramatic reductions in blood lead levels in children and adults. We're finding, even at the lowest levels measurable, evidence of toxicity. And we're also beginning to find that low-level exposures to toxicants like lead, like tobacco, are associated with child and adolescent psychopathology, and in particular, I'll talk about ADHD. In the United States, we're finding that many of the environmental toxicants are, to a greater or lesser extent, associated with what we call the new morbidities of childhood. As the old morbidities, polio, cholera, and typhoid have diminished, we've seen a new form of morbidity arise: asthma, learning problems, behavior problems, many of these of quite high prevalence. Asthma, about 11%. Preterm birth, 8 to 12%, depending upon which country you're in. You've heard much about ADHD epidemiology from Dr. John this morning. In the United States, our best estimates using DSM-4 criteria are about 8.7%. And I'll focus mostly on behaviors and ADHD. The first two slides really emphasize the role of tobacco, which may not be especially relevant here because the evidence so far would suggest that a child is at risk if they are exposed during pregnancy to a mother who smokes. And smoking among women during pregnancy is quite unusual here, but this is an important concept, and then I'll talk more about lead, which does have more specific relevance to Saudi Arabia. In this slide, in New Zealand, Ferguson found that children who were prenatally exposed to tobacco, that is, the mother smoked, had a shift in their behavior scores, indicating that children who were prenatally exposed to smoke were more likely to have behaviors consistent with conduct problems, attention deficit type problems, and disruptive behavior.